Welcome to Kathryn Raaker's World. Innovation, culture, adventure, fashion and health, artists, destinations, traditions. This is Kathryn Raaker's World.
Hi, this is Kathryn Raaker of Let's Just Talk and Kathryn Raaker's World. Our guest today is Dr. Gwen Hewitt, infectious disease physician at National Jewish Health. She's here to educate our listeners and viewers about MAC lung disease, including the symptoms, importance of timely diagnosis, and how to screen for and treat the disease to recently updated NTM treatment guidelines. Welcome to our show, Doctor. At this time of year, it's really, people need to know what MAC lung disease is and including the symptoms. So can you tell us what it is and what are the symptoms? Because with COVID and everything else that we're dealing with, it could be really confusing. Am I correct?
Oh, you are absolutely correct. And so the symptoms of MAC lung disease are cough, fatigue, sputum production, and shortness of breath. And this infection is caused by a group of germs called Mycobacterium avium complex. And it's important to understand that we're all encountering these germs all the time. And most of us, the vast majority of us will never come into having problems associated with this. But it's really important for those folks who are having a problem with it, and they may not know it. They may say, oh, it's just my chronic bronchitis. That they empower themselves to ask their docs to make sure that their doctor is collecting a phlegm specimen or a sputum specimen to send it to the laboratory to see if this germ is actually in their lungs. Because we see this germ a lot in tap water sources, potable water sources such as drinking water or shower water, so we can grow it from the slime layer in our shower heads or in potting soil or in garden soil. So like I say, it's everywhere in the environment, but certain people may be more vulnerable to having it set up shop and cause a problem in their lungs. And those might be people with COPD or bronchiectasis or asthma, or as we know now, women seem to be more vulnerable and folks over the age of 65 are more vulnerable to this. So we need to be diligent about early diagnosis.
So do they physically have to go in to see their doctor? Am I correct?
Yes, because we need to check their sputum and send a sputum to the laboratory to have the laboratory try to grow the germ in the laboratory.
And a lot of doctors' offices are open now and they're really well prepared, for their patients to come in. So can you tell me, once you find out after the sputum test, what treatment options are available for MAC lung disease, and does it have severity? In other words, can you have it and it's a light case of it, or is it an ongoing situation with your lungs?
Well, let me answer the second question first. So yes, there are different varieties of seriousness to it. And that's what's really important, is if you are just starting to have symptoms, if we are able to diagnose this infection early, we can prevent a serious lung damage from occurring because we can get started on good antibiotics. And usually it's treated with 3 antibiotics at a time, usually for a year to a year and a half. And you will be followed with your doctor, usually a lung doctor or an infectious disease doctor, who's going to check your sputum monthly to make sure that the treatment is working, make sure you're feeling better actually with the treatment. And if for some reason you're having some side effects, see what we can do to manage those side effects, because there's always tricks of the trade to help folks tolerate the treatment. And again, I want to impress upon folks that it's really important that we diagnose you early. So in addition to what we're talking about today, I always recommend people empower themselves with more information. So going to the NTM treatment guidelines that we just formulated in this year in 2020, but also go to a site like maclungdiseaseinfo.com so you can read all about this, understand it, and be proactive and talk to your physician about, gosh, should we look into this and see if I've got this infection?
How sudden does it usually come on, doctor?
That's a great question. This comes on slowly. So we're not talking about somebody who has a bronchitis and may have a cough for a couple weeks or even 3 weeks and then it goes away. We're talking about a cough that's lingering for many weeks or even several months. So a cough shouldn't come on and linger. If you didn't have a cough and now you have a cough that's lasting into its second month, that's time to start talking to your doc about whether something's going on. If you already have a chronic cough and it's changing, or you're noticing you're bringing up more phlegm, that's a time to let your doc know, and that might be able to be handled over a telehealth visit, just to let them know, listen, something's changing with me. It's probably time I come in and see you. And then your doctor will want to get a sputum culture to see if this germ is growing.
Okay, so let's talk about the treatment options that are available for MAC lung disease.
So we start out usually with 3 antibiotics. And in addition to taking these 3 antibiotics, we think of the body as a whole. And I really like holistic medicine approaches. So we're going to teach you how to exercise because we really want you to exercise. We want you to do deep breathing because it helps clean the phlegm out. We want you to learn how to keep those airways cleaned out. And we have several things to help you with that. We want to work on nutrition because we know nutrition is really, really important to strengthen your immune system and make sure that you can help fight these infections. And then we'll teach you how you might be able to reduce exposure to these germs that are called environmental germs. And we're going to monitor you every month in some way, usually with sputum tests, maybe some blood tests, maybe some chest x-rays or CAT scans, and make sure that you're progressing and going in the right direction.
You know, I'm so excited about this information, doctor, because my mom probably had MAC lung disease, but she lived till she was 95, but she was always that chronic, she had a chronic situation. She would have pneumonia all the time, and she coughed all the time. And so, you know, this was 4 years ago, or 3 years ago when she passed away. But there's a lot of people that probably have it and don't realize they do. Is that true?
That is so true, and I'm sorry for your mother having to suffer with this process, whether it was MAC or not, but it can be hard to live with that. But yes, even more important to at least find out what's going on with the lungs. Do you have this infection? If you have this infection, how can we start treating? Even if you don't have this infection, we can teach you other things to help clean out your lungs better, how we can improve your nutrition, your exercise. So there's a lot of things that your docs can partner with you, as well as you empowering yourself to learn more information about MAC lung disease.
Where can patients go for more information about MAC lung disease? Let me say that again. Where can patients go for more information about MAC lung disease?
Well, there's many great sites, but I would start with maclungdiseaseinfo.com. And there are also new treatment guidelines. So if you go to NTM Lung Disease Treatment Guidelines 2020 on the web, if you type that in, you're going to see these guidelines. So both of these sites are rich with information about this lung infection, and I encourage people to be proactive to go search them out.
Well, I want to thank you for all the work that you're doing, doctor, and getting this taken care of for patients. And thank you so much for joining me on Kathryn Raaker's World TV and Let's Just Talk Radio. We'll get it everywhere, Doc. Thank you so much. Thank you. And we'll be right back after these important messages on Kathryn Raaker's World. Hi, this is Kathryn Raaker of Let's Just Talk and Kathryn Raaker's World. You know, as college students travel and go home for the holidays, no matter if it's any time during the year, COVID-19 isn't the only health concern they face. Meningitis is a potential life-threatening disease that poses a particular threat to teens and young adults. Joining us to explain what meningitis is and how to protect your child are GSK vaccine researcher Dr. Len Freeland and meningitis survivor and a para-athlete Jamie Schonbaum. Welcome to our show, Dr. Len, and welcome, Jamie. Very excited about having you on our show today. Dr. Len, what is meningococcal disease and what are the symptoms?
Well, thank you. I'm Dr. Leonard Friedland. I'm a pediatrician and a vaccine researcher at GSK. So meningococcal disease, also called meningitis, is an uncommon but potentially very serious illness that can result in lifelong complications and even death.
Who's most at risk for getting meningitis, doctor, and how is it contracted?
Absolutely. It's our teenagers and young adults who have a peak of illness, and that's where the CDC is recommending vaccination. It's recommended that our teenagers and young adults receive 2 different types of vaccines to help protect against meningitis. Now, the disease, the bacteria lives in our nose and our throat, and it's spread from person to person, and that places our adolescents at particular risk because they tend to be around each other and they tend to share things through kissing, from sharing cups, and also living in dormitories, for example, on college campuses. In fact, all of the outbreaks of meningitis from a group called B as in boy have occurred in college campuses, all due to meningitis B. The good news is that we have 2 different types of vaccines that can help protect against meningitis. Your teenagers and young adults have probably received one of those vaccines when they were a younger teenager, but the other vaccine to protect against Men B, only 1 in 5 of our teenagers and young adults have received that vaccine.
And welcome, Jamie. We're so tickled to have you on our show. Can you tell us about your experience with meningitis?
Yes. So back in 2008 is when I got meningitis. I was a new student at my dream university, and I couldn't even enjoy a full semester without contracting this disease. I was a healthy student one day, and then the next day I was fighting for my life, wondering if I was going to survive. My first symptoms were flu-like to really debilitating to I couldn't walk on my own. I was freezing cold. And then by the time we got to the hospital, the doctor highly suggested that my mother basically demanded to be there. And I saw my limbs go from red rash to purple to black. I couldn't move. This is how I learned what meningitis was. And I had to get my legs below the knees amputated and all of my fingers amputated as a way to save my life.
And Jamie, how has your life changed since contracting meningitis?
Yes, it's not ideal for a college student. My life has changed completely from opening doors, all hands-on things became very different and new. I didn't know how to hold a brush or to pet my dog. But I was able to learn how to walk, and I was also able to learn how to get on a bicycle. And before I knew it, I was on the USA Paralympic cycling team. So I guess you could say I was determined to succeed, but I was also I am determined to educate people about meningitis, to make sure people don't go through this and to help families avoid getting meningitis.
Doctor, why is vaccination still so important?
Vaccination is so important. As you just heard from Jamie, this can be a very, very serious disease. It's uncommon, but it can be very, very serious, and it can be completely unpredictable who gets sick. You know, Jamie is one of my personal heroes for sharing her story and helping to educate parents and teenagers and young adults about what this disease is. It's very important that we make sure that we're completely up to date with all of the vaccines that are recommended to keep ourselves healthy, particularly right now in the setting of the pandemic. We want to do everything we can to keep ourselves healthy, and that includes the 2 different types of vaccines to help protect our teenagers and young adults against meningitis. Parents, your teenager likely received one of those meningitis vaccines when they were a younger teenager, but as mentioned, they may not have received the one to protect against meningitis B. And there, only 1 in 5 of our teenagers and young adults have received that vaccine here in the United States. You know, it's winter break right now. This is a great time for us to make sure that we schedule an appointment, speak to our doctor, make sure our teenagers are up to date on everything to keep themselves healthy, including asking, has my teenager, my young adult, college-age student received both types of vaccines to protect against meningitis, including the one from meningitis B as in boy. And so to learn more, we've created a website where parents, you can learn more about what is meningitis and the 2 different types of vaccines to help protect, including the one for men B as in boy. And that website is the following, meningitisb.com. And I'll spell that, MENINGITIS, B as in boy.com. And go ahead, make that appointment, speak to your doctor. And by the way, it is safe to go to the doctor's office and get fully vaccinated right now and get your routine medical care. meningitisb.com.
I want to thank you, Dr. Len and Jamie, for your mission in getting this message out. And we want to thank you for joining us today for this very important subject. Thank you. And we'll be right back on Kathryn Raaker's World and Kathryn Raaker's Let's Just Talk.
Of course, thank you for having us.
Hi, this is Kathryn Raaker of Kathryn Raaker's World and also of Let's Just Talk. You know, startling results from a new health trends survey reveal that women are disproportionately experiencing the physical and financial and mental impact of the pandemic. The survey also finds fear of COVID-19 exposure is leading Americans to avoid preventative or routine care and even preventing people who need a COVID test from getting one. Dr. Harvey W. Kaufman, Senior Medical Director and Head of the Health Trends Research Program for Quest Diagnostics, joins us now with survey results and to talk about why it's important for Americans to get back to care. Welcome to our show, Dr. Kaufman. How are you?
Thanks, Kathryn. Great to be here with you.
Oh, great. You know, women are disproportionately bearing the negative impacts of the pandemic. Can you tell us what the survey revealed?
Absolutely. So let me start with the survey itself. We were guided by our mission to empower people to take control and take actions to improve their health outcomes. So we collaborated with the Harris Poll and surveyed more than 2,000 American adults across the spectrum, across the United States, to unearth, to understand what's the real issues behind the catastrophe of this pandemic. And as you mentioned, one of the findings is that women are being disproportionately affected, and that they expressed more concerns about stress, about mental health, physical health, and the financial hardship of the pandemic. One reason is because women tend to be the caregivers in their nuclear and extended families, and they put those priorities first. And they do so at their peril and the peril of their loved ones.
And you know, fear of exposure to COVID-19 is leading many Americans to delay routine or preventative care. What is the potential impact of these delays, doctor? And that could be something really, bad if they don't.
Exactly. So in the survey, 60% of American adults said that they delayed or canceled an in-person medical appointment. That's a startling number. It's a large number of people. And as we delay care, we have the opportunity for it having disease move further along to a higher, more aggressive stage, an organ damage that's irreversible. So some people will need more aggressive therapy that will be less effective. And unfortunately, some people will die as a consequence.
You know, doctor, it's so safe now to go see your doctor, which I've done quite a bit lately in the last few months. And they're so careful. And I mean, the minute you even walk into the door, they put a temperature thing on you. I mean, you're wearing a mask. I mean, they scrub down everything. So why are people so scared?
So, Kathryn, I've been in the same situation. I've been to a patient service center, to the dentist, to my doctor, and health professionals get it. So there's no reported case where someone's gone for health care and been infected. So we need to fight the fear, the concerns, the anxiety people have with facts. We provide a website, questdiagnostics.com/peace of mind, that provides people some reassurance so that we are engaged in our healthcare before things do get out of hand.
Right. And who's most at risk of delaying care? Especially cancer patients and heart patients, right, doctor?
It's really everyone. So we've looked at the Quest Diagnostics data. There's a gap in testing for lead in infants and toddlers. There's a gap in care in testing for chlamydia and gonorrhea, two sexually transmitted infections that young adults who are sexually active should be tested for. And then as we move older individuals, there's gaps in care and screening for blood pressure, hypertension, and diabetes, chronic kidney disease, and many other conditions. And for cancer, there's gaps in testing and care in cervical cancer and prostate cancer. Mammographies are down, colonoscopies, and vaccinations. And we will all suffer the consequence as a large group of individuals will present when they do, and they will present in some cases in a more aggressive later stage of disease.
You know, fear of exposure is also preventing people from getting tested for COVID-19. What did the surveys show, doctor?
Yeah, that's one of the more shocking numbers, which is that 74% of people who felt that they needed a test opted to either not get a test or delayed in getting the test. And what that does is they become vulnerable themselves, and they can spread infection potentially to other people in their household and in their community. And if we waited till we were in respiratory distress, we'd be more likely to end up in an intensive care unit, need more intensive care with worse outcomes.
Right. And you know, after 9 months of dealing with COVID-19, what lessons have we learned about it?
Kathryn, that's really the best question because, reflecting back on what we've learned so much about SARS-CoV-2, the virus. We've learned so much about COVID-19 and how to treat patients better. The unprecedented development of multiple very effective vaccines that are being rolled out. That's the science and the medicine. And what this Quest Diagnostics Health Trends Survey highlights is really what's in our hearts and what's in our mind, which is the fear, the anxiety, the concerns. And we need to address that straight on so that people are engaged and see health professionals and get the services that will keep us healthy in 2021 and beyond.
What do Americans need to know, and where do my viewers and listeners go for more information?
Yeah, they need to know that healthcare settings are safe. And for more information, one can go to questdiagnostics.com/peace of mind. A lot of good information there.
I can't thank you for your mission. I went to the dentist yesterday. They have so many preventative things from you not getting it. And I've already had COVID-19 back in March and did a video on it to let people know across the world. So thank you for your mission. Thank you what you're doing. We really need to get that message out there, doctor.
Thank you. Thank you for what you're doing and spreading the word.